Did you know that every single tooth we have is a complex living organ? Yes, it certainly is. And the same blood and lymphatic fluid that flows to and through our heart and all the other organs and systems in our body also flows to and through our teeth. There is also a fascinating system of nerves that connect our teeth to our brain, and amazingly, every tooth is connected to one of our channels of life force energy, most commonly known as acupuncture meridians. When we see the whole picture, we naturally understand that our teeth will be affected by what's going on throughout the rest of our body, and of course, the rest of our body will be affected by what's going on in our teeth. Hello and welcome to this first set of web series on issues that are near and dear to my heart. My name is Dr. Lina Garcia, and I am a doctor of medical dentistry, a doctor of dental surgery, and I have done extensive training in hands-on osteopathy. I have also enthusiastically studied nutrition. I think it's also important for you to know that I am too a dental patient, and my motivation for producing a web series is to share with you and all dental patients who are interested some uncommon knowledge and understanding about the influence that dental procedures and materials can have on our general and long-term health. My intention is to help you make truly well and wise choices when it comes to your dental care. Of course, none of us can truly make well-informed choices in any aspect of our health care if you don't put some time into learning about the choices we have before us, as well as time into considering how the choices we make today could affect us in the future. Since you're watching this, I am confident that you already appreciate that it is worthwhile to take some initiative to educate yourself about the proper care of your precious body. I am equally confident that you already appreciate the value of learning more about any dental or medical practice before you allow yourself to be practiced on. What I offer to you in this series is a close look at dentistry in the 21st century from a holistic perspective. The word holistic is very important to me, and please allow me to suggest that it should also be important to you. When we are taking a holistic approach to anything, we are honoring the importance of the whole being and the interdependence of all the parts involved rather than focusing on just one individual part of the whole. To help you better understand who I am and what motivates me, I would like to share with you some relevant facts about my personal history. I grew up in a rather unique community in Brazil, where the people had a deep appreciation for our body's natural capacity for self-healing. It was understood that when someone was suffering from illness or injury, the focus needed to be on removing obstacles to healing while supporting the body's innate capacity for healing. They knew that good health encompassed the whole person, mind, body, and spirit, together with the free flow of life force energy throughout. I learned that helping someone heal involves so much more than just treating an individual part of the physical body. A person should not be seen as a collection of parts or as a disease label. We all have a self-healing potential as an innate part of ourselves. Our healing potential is part of something in all of us that never gets diseased. It is what I simply like to call the health. The choice I made to practice dentistry with holistic awareness evolved from my youthful fascination with healing, together with a strong intuition that guided me as I learned about the anatomy and physiology of teeth, gums, jawbones, and the dental connection to breathing. My passion for truth and the love I have for sharing truth with people who seek my help is what motivates me to be a teacher and a healer in a dental profession where awareness of and concern of how the whole body could be affected by conventional procedures and materials is terribly lacking. The healer in my heart always wants to help a patient connect to all levels of their being and help them overcome the obstacles to their healing and the realization of good health. It is often true that the biggest obstacles to healing and good health can be found in a patient's mouth in the form of a root canal treated tooth, fluoride, titanium implants, mercury-containing fillings, and other shiny metal restorations. Now, please allow me to be a dreamer for a moment, as I imagine how beautiful it would be if scientific integrity and the ethical principle of first do not harm won the day, and the people in the positions of power and authority who have been promoting the use of mercury fillings, water fluoridation, and genetically modified foods decided to honor scientific integrity and the wisdom of first do not harm by withdrawing their support for the use of these toxic substances. They certainly could do this if they chose to do so. And in order to help them facilitate such a beautiful change, there must be more people questioning the policies and practices that these authority figures control. Changing things for the better begins with questioning the status quo and ultimately requires that we make better informed and wiser choices in our dental and medical care and also in our food choices so that we do not end up supporting the dysfunctional aspects of the conventional dental and medical establishments or the dysfunctional aspects of the commercial food industry. The best way to prevent disease is to build your health. I believe that the health within us needs to be dedicated to acknowledging and communicating truth to anyone who is seeking it. I am passionate about helping people wake up the truth of the health within them. I'm also passionate about helping people wake up the truth of how dental practices can sometimes be a huge influence on either improving our general health or damaging it. Please allow me to take you back to your childhood. When you were a child and you use a forbidden word or phrase, your mother might have told you not to have a dirty mouth. Well, I stand firmly with your mother. I too do not want you to have a dirty mouth. But my definition of a dirty mouth has nothing to do with the language you use. If you have any mercury in your mouth or any other type of shiny metal restorations or titanium implant, a root canal, or persistent tooth decay or gum disease, then, in the tradition of your mother, but for different reasons, I will tell you that you have a dirty mouth. I hope, my dear viewer, that what I offer you will help you understand the importance of cleaning up, or even better, preventing what I call a dirty mouth. I highly recommend that you, your family, and your friends read my book and become aware of your dental choices. Well-educated choices might result in health rather than disease, longevity instead of premature death. May you continue to watch, listen, learn, and be empowered. Join me in waking up our nation in search for health and true freedom. Thanks.